Welcome to the Call Her Sam podcast. I'm your host. My name is Sam. If you're new here, welcome to the channel. Please don't forget to hit the subscribe button and check us out every Thursday at 2:30. Today I'm talking to Dr. Mwengwe Merai on something that's considered taboo. Not many people talk about it, but a lot of people inbox me asking me to talk about this particular topic, and I said, why not? So today we're discussing menopause, and I have Dr. Mwengwe Merai, who's in obstetrics and gynecology. How are you?
I'm good, how are you?
She just got off a shift, by the way, 24-hour shift?
Yeah.
Still looking fresh as a daisy. This is what it looks like, ladies and gentlemen. If you need a little example, this is what it looks like. How are you doing?
I'm good.
Happy New Year.
Happy New Year
I have
to
not
you
seen
too.
you this year.
Yeah.
This is my first time seeing it. This is my personal doctor, by the way. Mm-hmm. She's my personal doctor. So today, menopause. We're getting into it. Please, could you enlighten? What is menopause?
So menopause is basically the permanent cessation of menstruation.
Oof.
Is where you stop having your menses permanently. It signifies the cessation of ovarian function.
Okay.
And the end of reproductive life for a woman. Yeah, basically that.
So you're saying the end of menstruation.
Yes.
Okay. Okay, I will come back to ask you a question on that. So talk me through the 3 stages of menopause.
So like you've said, there are 3 stages. So we have the perimenopausal, the menopausal, and the postmenopausal stage.
Okay.
In the perimenopausal, this is when, remember, for you to have your menses, you need to have a functional ovaries. So this is when the ovarian function have started declining.
Okay.
And there will be changes that are going to occur to a woman. Some experience prolonged menstrual cycle, some will have irregular menses. For some people, though rare, they may just have an abrupt cessation where just poof, they have no periods at all and they never come. Then we have the menopausal stage when the periods now stop. And then we have the postmenopausal, that is 12 months of no periods.
Oh.
Then we get into postmenopausal stage.
I don't know if it's because that sounds scary. Because when it just stops, you're like, wait, what? What is happening? Especially if you're not up to par with this information. Because obviously when you stop your message, you're like, oh, something's wrong with me.
Exactly.
So now I need to go get checked, something's up, but then not knowing it's menopause.
Yeah.
So the perimenopause, that's before now the full-blown onset menopause takes on. Okay, so a lot of women, their symptoms are usually dismissed as something that will go away and you'll be fine. They're not correctly diagnosed. So how does menopause affect the body?
So the menopause affects the body, affects all systems of the body.
Systems?
Yes. So it will affect you psychologically, mentally, and also your social aspect. It will affect your cardiovascular system, your heart and its circulation. It will affect your digestive system, your urinary system, as well as your reproductive organs.
Okay.
To cite some examples on social and psychological aspect, people tend to have depression, they will have mood swings, the hot flashes, they are easily irritable, and some may even go into depression. Then when we go to the cardiovascular system, there's an increase in cholesterol levels. So this cholesterol, we know cholesterol is not good for us.
Okay.
So
is that when the weight gain happens?
Yes, you begin to gain weight, you are prone to stroke, you are prone to coronary heart diseases, you are prone to formation of blood clots in your veins. Exactly.
This is coming at me fast because you're saying, so wait, so you can't prevent this from happening. Like, how do you prevent this from cardio? Because you're saying you can go into heart failure?
Not heart failure, coronary heart diseases, where a clot forms in the blood vessels that supply the heart. Then you can have what we call a heart attack. So you are prone. Not that it's going to happen to everyone.
Okay.
It predisposes you to these things.
Oh my goodness. So how do you avoid that? from happening? I know it's a life thing. You can't obviously avoid it, but do you eat better? Do you exercise more?
Lifestyle modification is key. Yes.
Okay.
You do your exercises, you change your diet. If you're taking alcohol, you reduce or stop. If you're smoking, you reduce or stop.
Okay.
Stopping even better.
Okay.
Then it also affects the urinary system, the gastrointestinal tract.
Okay.
So, there are muscles in the gastrointestinal tract. Find that those muscles will lose their tone. And food will move slowly, and you're prone to constipation. The same thing happens in the genitourinary system. The bladder tone is lost. The ureters lose their tone, so meaning urine transit is slowed down, so meaning you're prone to UTIs, urinary tract infections.
Okay.
The muscles of the pelvis lose their tone, they are weakened, meaning you're prone to prolapse, you are prone to urinary frequency, incontinence. And then on the reproductive system, we have the breasts. They begin to sag because they're losing their fat. They will begin to sag and reduce in size. The ovaries reduce in size. The uterus also reduces in size. When we come to the cervix, we know that there are glands on the cervix that produces fluids that's supposed to keep the vagina and everything moist and all. So those glands are reduced, and then there's reduced production of that fluid, meaning you're going to have vaginal dryness.
Okay.
And all its complications that will come. So you find that your vagina is dry, there's loss of tone, you're going to have painful sex, what we call dyspareunia.
Okay.
And then you are prone to infections, and you lose remember, having painful sex, you're not going to enjoy that sex.
Yeah.
So you lose that desire to have that sex. So you just lose the interest, what we call, you lose your libido.
It just goes down.
Yes, your interest is just not there because it's painful.
So you said the muscles, the cervix muscles weaken.
Yes.
I've heard of a science that actually says this is where women need to start doing their Kegel exercises.
Yes,
how does that help?
It's very helpful because it's going to strengthen your muscles.
Okay.
Strengthen your muscles, then you sort of return the tone.
So is there a specific amount you should do? Like, is it like twice a week, 3 times a week, and do 50 Kegel exercises?
As much as you can.
as much as you can. So for the dryness, how do you? Is there a natural way to bring it to bring some
lubrication?
Some lubrication. Yes.
Exactly. Yeah, so we do recommend lubricants. There are lubricants on the market that you can buy and use during sexual intercourse. Estrogen creams, so that you have some estrogen that can help with production of those fluids, so that the vaginal dryness is reduced.
So at what age is a woman expected to go through menopause?
So for perimenopausal, it usually starts after 45 years, but there are some who experience it earlier.
As early as
40, you start having the symptoms. Some even before that, but
before.
Yeah.
Have you encountered somebody who's had
there are
before?
those that have premature menopause. Yes, but 45 years to 55 years, with the majority falling around 50 of years.
Okay. Can you still get pregnant during one of the 3 stages of menopause? Is it possible? I've heard before somebody's going through menopause. The 72-year-old woman who had twins, she's like way past, but then she still got pregnant.
So remember we talked of the stages of menopause. We have the perimenopausal, menopause, and postmenopausal. So in the perimenopausal, there's reduced ovarian function. Remember, the ovaries are the ones that contain the eggs when it comes to a woman. Okay. So there's reduced function of the ovaries.
Okay.
So like the ovaries are not functioning. They are still functioning, but their function has reduced.
Oh.
So you You may ovulate. Sometimes they have an ovulatory cycles where they're having periods, but no ovary has been produced.
Okay.
You have not ovulated.
Okay.
Other times they may ovulate. So during this period, you may get pregnant.
So it doesn't matter how old you are, you could be 65 and still get pregnant?
Yeah, there are people who have late menopause. It starts very late. So if you're in your 50s, yeah, that's when your perimenopausal has started, you may get pregnant.
So what are the signs or the symptoms of menopause? Like, how do you know? Because the most common one I've come across is a hot flash.
Flashes.
Yes.
Because that's the one that most people talk about.
Yes.
So like we have said, it's every system. So you have your hot flashes, mood swings, irritability. You just get irritable by just little things.
Well, that happens now to me, doctor. I'm just like,
yeah, exactly. And then there are things that are happening that we can't basically see, like the coronary, the consequences of the high cholesterol that we talked about, the vaginal dryness. Then it also weakens the bones. Remember, calcium is being lost, and then just trivial exercise, maybe a trivial fall, someone may have a fracture. So they tend to have osteoporosis. They lose bone mass.
Okay.
And then their bones easily break.
Oh my goodness.
So there are several symptoms that one will present with. Some we can easily notice, others we tend not to even focus on them because they're not so pronounced.
Yes.
And then we need to note that in some people, they'll just have this lack of period, and the symptoms are not there. These symptoms are not occurring in everyone. For some, they'll have. Others will not have these symptoms.
They'll just be, they'll just go through life.
And then others, it's mild. Others will have the severe form.
Okay. So are there natural ways to manage symptoms?
So for instance, I'll give an example of hot flashes. So for hot flashes, like all in all, with just menopause, what is needed is assurance and counseling of the person.
Okay.
So with hot flashes, you can counsel the person. You let them know what is happening because they're new to this thing. So
they know what's happening.
You counsel them. They get to understand what is going on. That is a natural thing, and it will come to an end. Then you can advise them to wear light clothing.
Okay.
Light clothing, drinking cold drinks just before bedtime. Then if during activity they pace themselves, they don't hurry through activities. They can do yoga, they can do meditation and simple exercises like that. It helps reduce the effect, the hot flashes.
What about walking?
You can also take walks.
Okay.
It also helps.
Okay.
But if it's so, there are also drugs that you can use.
Yeah. But for the people who don't want to use the drugs, there's still the drugs on the market. Okay. Now, some women feel like their life is over once menopause starts. They're like, it's just downhill from here. There's nothing on this earth for me anymore. Like, it's just, we don't know what's happening. What measures are put in a place from a medical perspective to reassure women otherwise?
So basically, it's reassurance. Reassurance, you counsel these patients. Talking to someone, we always underrate just talking. Sometimes you don't even you don't need to do anything.
Just talk.
Just talk to that patient. Reassure them. Educate them about what is happening. And it will put them at ease. And they'll even get to see the positive side of it. And you find that even the symptoms get better. So counseling, then you educate them about lifestyle modification. They do some exercises, eat healthy, take their vitamins, vitamin D, calcium, and vitamin E to help with the skin changes, as well as prevent the bone changes that are coming, as well as the hair that are going to begin, the hair changes that are going to happen to them.
So the hair loss is also a thing, like it's...
The hair becomes dry and brittle during menopause.
And you mentioned skin.
Yes. The skin becomes wrinkled. Remember, it's losing its elasticity. So it will become wrinkled.
So what I know it's a natural stage, you know, aging is we can't run away from it.
Yes.
But what can we do, Doc? I mean, we can't afford Botox. All of us can't afford Botox. So what do we do to, okay, not prevent, but maybe just smooth it over a little bit, just to make sure it's not too, you know, not too wrinkled. See
Like
how
I
we're afraid of
mentioned,
wrinkling?
The exercise, the vitamin E, vitamin D helps.
Okay, vitamin E, vitamin D.
And exercising.
Okay, so vitamin E, vitamin D also is in the foods as well as the supplements?
The supplements are there on the market.
Okay, all right. So what treatments are there for, first of all, before I come to that, women are going through these changes. Are men also a part of the explanation? Because obviously the woman comes in to see you. Are men also prone to this information? Like, are they privy to this information to understand what's happening? Have you encountered
no. Maybe that's the thing that we need to bring out, so that we educate the men, so that they support their wives.
Because obviously they don't know what's happening. You're going through this thing, and then you're not able to speak.
They just wonder, this person today is just irritable. All of a sudden they were happy, now they are sad,
Now
they're shouting. Yeah, so we need to educate the men out there so that they give us support. Because remember, part of treatment is support. And counseling. So if we have a man who's privy to this information, he will support the wife, he will support if it's a sister.
And treatment, like I said, is there any treatment on the market that's, and it's a natural process, but apparently there's treatment that depends on the severity of the menopause.
So for treatment, we always start with counseling and lifestyle modification.
Okay.
There's what we call hormone replacement therapy.
Okay.
Hormone replacement therapy. Basically, you want to treat to make someone's life bearable.
Okay.
To prevent osteoporosis and these are the other symptoms of that are accompanied with that comes as a result of menopause. So we have estrogen.
Okay.
We can give estrogen, the hormone estrogen. Separately, we can give combined with progesterone, or we can give progesterone only.
Okay.
And the treatment can be given between 2 to 5 years. But we have to bear in mind that, remember, this is a natural process that was designed to come to an end, and then you want to bring in something. So this treatment is not without complications. So this treatment may put you at risk of endometrial cancer, may put you at risk of breast cancer, may put you at risk of Alzheimer's disease, dementia, and venous thrombosis.
So,
but it is helpful. It's not like you're going to get the complications, but it puts you at risk of those things.
It puts you at risk,
if with the cancers, especially those that have a family history.
Oh my goodness. Oh my goodness. Okay. But you're saying, you said the ovaries, you still can get pregnant. So on top of everything else, do you still have to take your birth control as well, or it's something that you can just do away with since you're going through menopause? Like, it's fine, we can.
During your perimenopausal period, you can take your birth control.
Okay.
So you may never know when you're going to ovulate.
Okay.
Yes.
Okay.
It's not like determined like, oh, this month I'm going to ovulate, the other month I'm not going to. You may never know when that ovary is going to decide to come out. So you can take your contraceptives during your perimenopause stage.
So when do you get to see a doctor? So if I'm having symptoms, very mild symptoms, do I go in to see my doctor and be like, no, it's fine, it'll pass, it's fine? Do I just go in because when something happens, I'm like, I need to go and see the doctor?
Yes,
I need
you
to
can
go
go
in.
and see a doctor. Sometimes you may not know. Not everybody knows what is going on with their body. So you go and you find that sometimes you may think it's nothing when it's actually something.
Yes.
So you go and see a doctor, The doctor will take their history, examine, and determine what's going on. You may think it's menopause when it's actually something else. So my advice, if you're feeling something that you think maybe this, do not self-diagnose yourself.
And we love to self-diagnose.
Go and see a doctor. You have a chat. You are examined, and if there are investigations that need to be carried out, they will be done.
Okay.
And then you come back with at least a peaceful mind, knowing what's going on with you.
Yes.
Than you assuming it's nothing when in the actual sense there's something.
It's something going on.
Yes.
Okay. Okay. We will continue
All right.
part 2 because I still have so many questions, and I'm sure a lot of people still want to hear about the menopause symptoms, how they can get it under control. Exactly. Because I do have a few aunties who they obviously don't understand what's happening in their body. They're just like, leave it in. They were like, why don't you go to the doctor and get it checked out? No, they'll go and find something. I don't know if it's fear of going to the doctors and they'll find something else on top of everything else having to deal with something.
Most people have this beta and shishi,
the fear.
Exactly. But you need to know.
I agree.
I think
you
that's
need to
the
know.
first step.
Yes.
Towards healing.
And there's not much info.
Knowing.
There's not much info about
if you don't know what is going on, you will not take a step towards healing.
That's true. That's true. Thank you so much for coming through.
We'll
do a part 2. We will do a part 2. Thank you so much for tuning in, and I will see you soon.